Do you find that that closeness transcends the boundaries of the company? Have you found success and maybe some acceleration through building the partnerships with the providers, with the patients? I think I've heard you talk about the model being sort of bringing those clinical trials to Main Street.
Right.
Can you talk a little bit about the importance of those partnerships with those target audiences and those target partners and how that's impacted your scale?
Uh, Tremendously. So there's lots of folks in clinical research that almost treat, just to be dramatic, I'll use some of these words, almost treat the doctor, the provider as maybe their vendor, um, not a partnership. And we borrowed a business model from the ambulatory surgery center model, Surgical Centers of America. But what they do with partners is they create joint ventures, or they create a joint business entity that has rules around it, and both parties put in capital, but has rules around it in treating it like any other ancillary in a big health system. Not, um, sometimes if you're treating each other like vendors, it could be that the research group is maybe a parasite on the host, just getting those doctors time, distracting them from healthcare, having them do one more thing. Research is a different business. It's very different than healthcare. So it can be taxing, I'll say. And so if you go into it with that mindset, it's from a negative. Even though if the doctor step back, everybody's positive about research. It's just this time element in the world we live in, and healthcare is very complex. So we went in and said, okay, we're not going to treat you, doctor, like a vendor. We're not just going to give you some small payments and then we take your patients and perform research. We're going to be completely transparent, and together we're going to go to pharma. We'll negotiate the contracts, but everything we do is completely transparent with you, our partner in building a sustainable, profitable centers of excellence. And so we went in with a completely different mindset on building little centers of excellence with our franchise, with our doctors, and that transparency gives us the keys to the kingdom. Unlocking the EHR, we have all of our providers' schedules. I probably have all of our doctors on my cell phone. And so we're partners. And so we do not deviate from that transparency. And I know lots of folks talk about transparency, but particularly in healthcare, I'll stand up for doctors in that they have been burned by other partners who didn't treat them really as partners, that they're off doing healthcare and somebody's doing something else. So they're very protective, and I understand that, and we respect that. So we have a doctor as a co-founder, but we are a doctor provider, not just doctor, nurses, and advanced providers too, as part of our organization. So I think that helped fuel that transparency, and that business construct that supports today. Transparencies helped our partnerships. And in exchange, we can find any patient anywhere in any EHR. So, if you want the keys to the kingdom, you're going to have to, be a partner. That would be my
Yeah.
thought.
Yeah, you actually have to know the people who are holding the keys. I
Yeah,
think that is
that's a good point.
incredibly good counsel to, other startup founders, particularly when you are early stage and resource strapped, whether that's resources, people on the team, or just the money to be able to go be in the world alongside, the people in your marketplace. I think the tendency is, well, I can do it online. I can do what I need to do from here. And
Yeah,
what I hear you saying is have to you have to be there. You have to
you
build the
have to.
relationships. I mean, I think
You
I
have to
heard you
see the
use the
people.
word partnership,
Mhm.
probably 20 times in that description, and, and transparency. And you're talking about perhaps one of the most gated industries there
Mhm.
is. So,
True, true.
yeah. So your counsel is incredibly well made. So I'd love to hear, obviously you are solving a lot of big problems, and you've talked about this area in GI that is really pressing. Are there any, I'm going to go ahead and let's go all Jim Collins here. Do you have a BHAG that you're just sort of, you've got on the horizon that you are working toward as a company or a team?
Sure. So we want to scale out our franchise, our network, and build it across, say, 130 sites. It isn't about being big. It's really about, can we make a difference on pivotal trials with our volume and our input? Can we change the pace of the entire trial? And so it's different in different therapeutic areas, but that's what our aim is to be able to walk into a given prevalent disease in the community, be really selective about that, make an impact, and get it done 3 times as fast as anyone else with our providers. So that's what we're trying to do. On the next level, we have an aspiration to continue to be the innovation partners for our partners. And so, as an innovation partner, we see this gaps in care. If you think about clinical research, the only reason researchers are developing a new compound is because there must be a gap in care. They think they've got something better than what's on the market, or there's nothing on the market. There's no solve. And so this gaps in care concept that we're partnering with providers, we see an opportunity to work in the digital biomarker space. So we're in the EHR and we're building algorithms to find the right patients for the right trials today. That's what we do today with tech. And we're tagging the provider to let them know this patient's eligible for the trial that's running in your practice, because these are busy healthcare practitioners. We want to take that to the next level and understand the sequence of events that led to a patient having a gap in care. And we want to tag that patient and so the doctor knows what else is available for that patient in digital biomarkers. So that's probably the next thing. That's probably 4 years out. I don't know, but we have so much research to do. But and then categorize that and hopefully share it as needed with the rest of the world. I mean, that's the idea.